Well, joining me live now is Aged Care Minister Richard Colbeck. Minister, good morning to you. Thanks for joining us. So, you were born in Melbourne. Can I ask you what you make of everything that's going on?
Actually, I was born in regional Victoria, so I'm not taking responsibility for Melbourne. But
well, a Victorian thing, yeah.
It is really tough. But I also currently live in a place that was locked down for a period of time during the height of the virus on the northwest coast of Tassie. We closed 2 hospitals. We had 5,000 hospital workers and their families in isolation for a period of about 4 weeks, and we haven't had a case in northwest Tassie or in Tassie now for about 50 days. So if everybody can go along with this, they can obey the rules, observe cough and sneeze etiquette, social distancing, washing your hands, taking all the appropriate measures, there is an opportunity for us to work our way through this. It's going to be very difficult, particularly for those businesses who have just reopened and are going to feel the pain of that, but also for people who are isolated. And so there's a range of measures that we continue to put in place to try and keep people connected, particularly in my portfolio.
Well, OK, we're on that, and it must be particularly concerning and frightening for those who are in aged care at the moment. Now, there is a report in The Age this morning that said that there were plans for the government to buy hundreds of defibrillators from overseas, but that never proceeded because Victoria flattened the curve. Do you have any concerns about that, if it's true?
Look, I think the work that we've done, and I've had the opportunity to be closely engaged with that right through the management of the virus, to make sure that we have the equipment in place to provide appropriate health care, has been exceptional. The officials in the department, Minister Hunt, and all of those working with us in the health portfolio have done an extraordinary amount of work to make sure that we have the hospital capacity, the ICU capacity, and the equipment that we require to provide health services. And that was part of the strategy at the outcome. Been significant investment, significant management. I think we're in reasonably good shape in that sense. So I think people can be confident that we have the capacity to deal with things that we need to deal with.
Right.
And we continue to pay attention to that.
OK, so can you guarantee that there are enough ventilators and defibrillators and intensive care monitors?
Well, in terms of the ventilators, we went through a process of acquisition at a local level. We've actually had some Australian businesses who are adopting their systems to provide capacity. I'm very confident that we've got capacity in the context of ICU beds and ventilators to make sure that we can do the work we need to.
OK, well, what lessons from the Newmarch House debacle have you learnt that is now in effect in Victoria?
Well, we have, I think, now very good systems to stand up each time we get a notification of an incidence of COVID in or around an aged care facility, and there have been a few in the last couple of days. I must say that a lot of that has come through the intensive testing that's being done by the Victorian Government, and that has provided us, I think, with some very good early notification of what's going on. It allows us to stand up our systems in conjunction with both the local public health unit and also the relevant aged care facility to make sure that we've got PPE available if they need it, to make sure that we've got the appropriate isolations in place, and make sure that it's mostly been staff, I'll say, but we're finding those early, and finding people early, being able to track and trace and isolate is really important to getting this under control.
Just on Newmarch House, you'd be aware that residents of victims are suing the owners of Newmarch House, claiming negligence. Do they have a strong case?
Look, I've seen reports of that. I don't think it's appropriate for me to provide any commentary on what might or might not happen there. But obviously, I was very, very closely involved with that on a daily basis. It's pleasing that that whole incident has now been cleared up. Tragic, the circumstance, but it just goes to show how devastating this virus can be if it gets out, particularly amongst vulnerable people and particularly the elderly.
Yep. OK, just on to your announcement today. There's, you might be able to see, there's our banner there, 6,100 aged care packages that are on the way. That announcement coming today. What percentage of those packages will be going to remote areas?
Well, they'll be rolled out across the country, commencing immediately, based on our national priority list. So they will be evenly rolled out across the country. And it's based on our national priority list. I have no capacity to interfere with that. That is something that's controlled by the priorities of people who are seeking aged care packages. And we continue our investment in that. We put 10,000 new packages into the system immediately after the interim report of the Royal Commission. They said this was a priority, so we've taken the opportunity, given the budget's been delayed, to put another 6,100, as you say, in now. Again, rolled out immediately, and that brings our investment into home care packages to over $3 billion since the 18-19 budget, and over 50,000 packages, and more than 100,000 since we came to government. So we understand it's a priority, and we continue to invest.
Can you just elaborate for those who might not be aware, what is a home care package?
Well, that's effectively providing care to Australians, senior Australians, in their home rather than having to go into an aged care facility.
Yeah.
So it's there are levels of package. We're working through a reform process of that system right now, which is something that we want to do to make sure that we get the best and the most value out of the dollar that we're spending. And of course, the Royal Commission's considering what options we might look at in that context as well. It
would make sense, though, wouldn't it, for those people who are in regional areas to be able to get some kind of priority for those packages, because generally services aren't as good as they are in metropolitan regions.
Well, when we look at the capacity of the residential aged care system and when we allocate beds, we also look at where the demand is. So we won't put new residential aged care beds in, for example, in a place where there's low occupancy or a lot of capacity. We look at making sure that there's a reasonable spread across the country of services. But the home care packages are allocated based on a national priority list. So as you come on, you work your way through the system, and they are spread right out through the country. And we'll see this continue to grow. The growth projections for home care and residential aged care continue to grow as our population continues to age, and that becomes one of the real challenges in how we manage the overall investment into aged care more broadly.
Okay, Minister, just finally, if we can switch hats and with your sports portfolio, you'd know about Alex Chumpy Pullen dying yesterday in absolutely tragic circumstances. He was one of the most popular members of the Australian Winter Olympic team. He was the flag bearer in 2014 in Sochi. Just what's your reaction to that?
Well, it's an absolute tragedy when you lose a close family member, a friend, somebody with the personality of Alex. Sincere condolences to his family, loved ones, and particularly those in his sporting circles. It is really a tragedy, a very, very sad loss, as you say. Three-time Olympian, Olympic flag bearer, so someone who's really made a mark during his life on not only on sport, but on his community.
Yeah, shocking. It was so young too, died at the age of 32. Aged Care and Sport Minister Richard Colbeck, appreciate your time this morning. Thanks for joining us.
Thanks, Peter.